Hey there, welcome to our mini course on low back pain and sciatica. My name is Dr. Andrew Grecki. I'm a physical therapist and owner of Superior Physical Therapy. And today, this video one is designed to talk about the number one biggest mistake that sciatica sufferers make. And that ultimately comes down to our decision making when we're trying to handle a problem. So we really have three ways that we can handle a problem when you think about it. And that's not just health problems, but that's any problem that we have in our life. The first thing we can do is we can ignore the problem. And I don't know about you, but I know that when I ignore problems, they typically get worse. And we know that the body in health is no different. Sciatica symptoms do not just go away on their own. We know there's tons of science and evidence to show that to be true. And I know because I see patients that wait 6 months, 9 months, 12 months, 2 years, 3 years before they come in and try to handle the problem. That happens to be the number one biggest mistake that sciatica sufferers make, is they ignore it. I can tell you a story. I had the first clinic that I had, we had a leak in the ceiling, very small leak. We could put a little bucket underneath it. And we told the landlord and nobody did anything about it. We ignored it. And one day, guess what? The pipe burst and the whole place flooded. We had to shut down the clinic. It was very expensive. And again, it's an example of ignoring the problem. Our sciatica and our low back pain is no different. The second way that we can handle a problem is altering the problem. This is actually what most people are doing when they're seeking treatment. This is what the medical system actually does to us. It gives us options on how to alter the situation, alter the problem. Let me tell you what the top three most common things right now in the medical system that are given to low back pain sufferers. The first one is meds. So pain medication specifically, but or anti-inflammatories. Both of those pain medications are going to alter how your brain perceives pain, so it alters the pain. The second thing is the anti-inflammatories, which are really just decreasing the body's response to the problem. We know that there's obviously, this is the most common, 265 million people last year got pain medication. Not good. The second thing is injections. And with injections, what you're seeing is injections of pain medication with anti-inflammatory into the nerve of the spine, which then for a longer period of time alters the inflammation, which ultimately doesn't provide a solution, but it gives people pain relief. These two are really important to help someone with pain, but it does not help them find a permanent solution. And the third thing is going to be kind of surprising to you, but surgery. Surgery is another way that they alter the problem. And what I mean by that is the surgeries that are out there for low back pain and sciatica, they only fix the structural damage of the spine. They don't address what actually caused the structural problems in the first place. So very commonly, in fact, 50% of people with low back pain surgery 2 years later have low back pain again because the problem wasn't addressed. The third way we can handle a problem is my favorite. It's fixing the problem. And I know this seems pretty basic, but it really is. It's almost funny how many people don't want to fix the problem or don't know how to fix the problem. And this is really identifying not only what the type of low back pain is that's causing your sciatica, which we're going to talk about in the video 2 and 3, but also what the cause is, which is what part of your body is moving improperly, and then ultimately handling it and asking experts for advice. That's where the movement experts, the musculoskeletal experts, the physical therapist, we are the musculoskeletal experts. That's where we come in and we give you specific guidance on what to do in order to fix the problem. So I look forward to video 2, talking about what sciatica is, and look forward to talking to you then. You might be wondering, why in the world are we giving away this mini course and we're trying to share all this information with you? And I really just wanted to clarify and just full disclosure so that we can build trust. I've been there before. I've been a back pain patient and I've gone through every possible treatment that you can imagine. And just like we talked about in this video, really altering the problem is really what I was given. So medications, injections, surgery. Actually, I went through surgery myself. And looking back, and the surgery didn't work. And so, it was really discouraging for me, very expensive at the time. I was a college student, very broke. And I think I had to pay $30,000 of the expense. The total was $100,000, but my insurance did pick up some. But really what I'm here now, my mission in life is is to get people the right information about low back pain and sciatica. And so that's what this mini course is about. And I also just wanted to throw out the idea that we're going to be hosting a lower back pain and sciatica workshop live that's about an hour and a half long, and we're going to cover the stuff that we just talked about in the first video, and we're also going to dive much deeper into the causes of low back pain, not the types, but the real causes and what to do about it. And so we're really giving away as much information as possible, and we want people to be informed, and we want people to get better, and we want people to get the right information. So I hope that you, if you're interested in learning more about the workshop, just click the button below this video, and you can learn about it. It's totally free, and